views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
And hello, everyone, and welcome to Open, the one and only show that opens the Bronx and the rest of the world right to you. I'm your host, Daren Jaime. Today, we'll update you on what's happening in and around our borough, as well as across New York City. Coming up on today's show, we go front and center discussing the efforts of one organization as they take on the need to get more people vaccinated. Afterwards, we'll sit with the department chair of pediatrics at AdvantageCare Physicians. She'll talk about the impact of pediatrics in the African-American community. Then a little later on in the show, we'll learn how the care for the homeless is actually providing behavioral health services that are helping individuals suffer from substance abuse. Also, we'll discuss the release of a song. Yeah, a very special song celebrating the work of Harry Belafonte. We'll give you more details about that. And then finally, we'll talk about the importance of women focusing on self-care. So we got a great show coming up. We want you to stay with us because all this and much more is heading your way. Right now, we're officially open. And welcome to Open. I am Daren Jaime. We thank you for joining us as we are here on the show that brings the Bronx and New York City straight to you. We also want to welcome our viewers on Manhattan Neighborhood Network as Open is being broadcast live simultaneously on the MNN channel. If you want to stay better connected to us, well, you can always go to our social media platforms at BronxNet TV and always our website at bronxnet.org. A lot has been going on through the course of this past week, but we're going to take you through a couple of things with our Bronx updates. We start off with community news. Phipps Neighborhoods welcomed U.S. Representative Jim McGovern to the South Bronx to discuss the Bronx Impact Food Access Collective aimed at combating food insecurity. Our Bronx reporter, Balan, brings us the details.
Organization Phipps Neighborhood welcomed Massachusetts Representative Jim McGovern to the South Bronx to discuss their initiative, the Bronx Impact Food Access Collective.
Today, a federal level official who oversees one of the most powerful committees in the country called us and asked us to show him where he could cut red tape.
The South Bronx is just one stop on the Congressman's countrywide tour to discuss different solutions communities are taking to address the issue of food insecurity.
I've been doing hearings and I've been traveling around the country looking at models and community initiatives that I think should be highlighted.
Community leaders toured several sites in the South Bronx to understand the importance of food justice and access to nutritious and affordable food.
For Bronx families, and I think families across the nation, they have to make a decision every month if they have to pay for expensive. If food is very expensive, it's going to limit their resources for the other things, the other necessities in life. So it's really important that we figure out how we can make sure that we get fresh food that is affordable for all that needed.
Serving as co-chair for the House Hunger Caucus, Congressman McGovern says this conversation is part of a larger initiative aimed to end hunger throughout the country by 2030.
I have been asking President Biden to do a White House conference on food, nutrition, health, and hunger to help us not manage hunger, but to actually solve it.
Reporting for BronxNet, Balan.
And thank you, Kibben. In other news, Fordham University recently made history, voting in their first lay leader and woman as president. Our Bronx reporter, Arlene Makoko, brings us all the details.
For the first time since being founded 181 years ago, Fordham University makes history.
This morning, the Board of Trustees unanimously voted Tanya Tetlow as the 33rd president of Fordham University, effective July 1, 2022.
Citing her successes as a layperson president at Loyola, where she served since 2018, Fordham University's Board of Trustees Chair Robert DeLeo announced the conclusion of a nationwide search that brought in 150 candidates that were narrowed to 4 finalists, with Tetlow getting their vote of approval this week.
The search committee, which included 2 Jesuits, worked closely with Jesuit leaders, including the rector of the Jesuit community at Fordham, to identify candidates, both Jesuit and laypersons, with a deep knowledge of and commitment to the goals and ideals of Jesuit education.
Outgoing President Father McShane, whose tenure began in 2003, spoke on the significance of the announcement.
Since we were founded in 1841 by Archbishop Hughes, we've always had a cleric as the president of the university. And since 1846, 5 years after our founding, that president has always been a Jesuit.
Times have changed, though, and Father McShane pointed to her abilities in leading Loyola through a challenging fiscal and enrollment crisis, both skills they feel are right for the college as the pool of Jesuit priests continue to decline. He shared from 1,460 in New York 55 years ago to about 320 today.
Tanya is an extraordinary leader. I've known her since she was named the president of Loyola University of New Orleans. Which is, it's a great school in a tough situation. Tough situation being this, storm after storm after storm has come through. And so the school has had to have leadership which was visionary, practical, not afraid of being on the ground, not afraid of being in coalitions, and not afraid of building very strong relationships with neighbors and with the entire city.
Tetlow, whose parents met at Fordham University and whose father was once a Jesuit priest, talked about the deep significance of the college's mission to strengthen its Jesuit tradition. She also shared some of her goals as she prepares to take on her new role.
For me, being the first lay president at Loyola, it was an opportunity to remind everyone that given the waning number of priests among us, that we have to own the mission as lay people, or else we will lose it. And that was true before the leadership was turned over to lay people. So it's a very visceral reminder that we all have to understand who we are and speak in that language and teach that to our students, such that when they graduate, they each have a very eloquent and coherent answer to the question of what does it mean to be Jesuit educated.
For BronxNet, this is Arlene Makoko.
Thank you, Arlene. And that's all the time we have for our Bronx updates. We want you to stay with us because guess what? We are not out of show. Open continues right after this. And welcome back to the show. Children's Aid is helping people in poverty to succeed as well as thrive. They provide comprehensive support to youth and their families, targeting high-needs neighborhoods. Now, the organization is doing more in the effort of working with the community to get more people vaccinated, as well as having COVID testing. We're pleased to have joining with us right now the Vice President of Health and Wellness at Children's Aid, Rhonda Braxton. And Rhonda, I want to thank you for coming and joining us. And when we talk about children getting vaccinated, we know that it's been an uphill battle. How have things been looking on your end?
Well, thank you so much for having me. Yes, it has been a little bit of an uphill battle, but Children's Aid is very dedicated to the community and ensuring the health and wellness of the children and families that we serve. So we really, at the beginning of the pandemic, we took to heart the idea that we have to go out and provide accurate medical information to our clients and their families, and to do our best to provide the best services to the community.
And you're not just waiting for people to come through your doors. Obviously, you have some mechanisms that you're actually reaching people. You've got testing buses right in the borough of the Bronx. Talk to us about your buses and the work that it's doing there.
Sure. Well, we first started with health education. We wanted to make sure that everyone had medically accurate information. So we had webinars, we had flyers, other campaigns, and then we partnered with other community organizations, even before we were able to provide vaccines at our sites. But testing was paramount to the success of the initiative. We partnered with the Health and Hospitals Corporation, the Test and Trace organization, to get testing mobile vans, buses at our sites, primarily in the Bronx. That's where we started because we wanted to address the high risk needs of our community. We advertised those services, partnered, had the vans there 7 days a week on a weekly basis. And we're really proud to say that through that partnership, we were able to provide 7,000 tests altogether, 5,000 tests in the Bronx. And later, when the vaccine became available, we were also able to use those same resources for vaccination.
We know within the African American community and communities of color, there is a huge vaccine hesitancy. When it comes to testing, even that as well. Did you find that you were able to break down some walls, if you will, to be able to get people to become more receptive, given the fact that so many people still have some questions, even though we're making some progress, but still have a way to go?
Absolutely. Again, it was our goal to chip away, well, really first acknowledge the hesitancy and the reason behind it, acknowledge the background that communities of color have had negative experiences historically with the medical field, and just address that head on, have informational sessions, have trusted people of color and pediatricians who are known to be trusted resources in the community to have one-on-one conversations, to educate first our staff and from the front desk on as to accurate information, how to speak to clients, again, webinars, one-on-one conversations, any kind of outreach that we could provide, partnering with New York City Health and Hospitals Corporation, with the Department of Health, other community-based organizations to get accurate information out to the community and to be able to provide a forum for people to ask questions and really to ask, did you get that vaccine, Rhonda? Would you give it to your children? Absolutely. So to serve as a resource for the community.
In addition to working with health, I know the Children's Aid has really got a variety of different programs. I'm pretty familiar with the organization, but for somebody who's not, talk to us about who Children's Aid actually is.
Well, we are a longstanding social services community organization providing resources to the community, and our mission is to help children living in poverty to succeed and thrive. So we really have four domains of work: education, social emotional support, family and health, family and home, and health. I'm representing our healthcare community here at Children's Aid, but we have educational programs. We have charter school, charter middle school, and elementary school located in the Bronx. We have many social services programs. We have after-school programming and summer camps. We have programs that connect families to resources for healthcare. We have our own foster care agency and resources to provide preventive services so that children can stay and families can stay out of the foster care system, and support for those who are in the foster care system.
And so for you, obviously a comprehensive array of services that are actually provided. But when you talk about drilling down into the area of health and seeing health, talk to us about that, because we know that sometimes when it comes to young people, and particularly those that are in foster care and those that are in need of in the underserved population, sometimes access to services is not always so easy. So talk to us about what it feels like to be able to bridge that gap and the impact that it's having in the lives of your children.
Absolutely. I've really dedicated my professional career to bridging that gap between accurate medical, high quality services and providing it to communities in need. Part of the way we do that is we are actually physically located in those communities of need. Our services are in areas that historically may not have had access to those services. We're located in Harlem, we're located in Northern Staten Island, Washington Heights, and the Bronx. We do a lot of community outreach. We engage the community to see what their actual needs are. In addition, peers to help us to provide those services and health information to young people. So the messaging is better received if it's from someone who looks like you, who has your same life experience. It also provides us with the opportunity to mentor young people and show them various career paths in health education, outreach, social services, et cetera. So we really have our boots on the ground in the communities in need, and engage people kind of firsthand in the services that we provide.
And I know you have some health centers that are located in the borough of the Bronx. Why don't you make our viewers a little bit more aware of the health services that are provided?
Sure. So we have a large health center located at 910 East 172nd Street, open to the community. We provide services there for newborns to the age of 22. Services include primary medical care, dental care, behavioral health services, reproductive health care, health education and outreach, food and nutrition programming, and healthcare management. We also operate another community clinic in Harlem and 6 school-based health centers. One of our school-based health centers is in Charles Drew in the Bronx. So we are really entrenched in the community in the Bronx and providing services at those sites. At our Bronx site, we also have services that are specifically geared towards children and adolescents in foster care and their families. And we have a team of clinicians who provide extensive medical services for foster care children who have maybe some advanced medical needs.
Well, Rhonda, you did say it best, that you have the boots on the ground, and thank you for the work that Children's Aid is doing, particularly in the area of healthcare and making sure that our young people are afforded an equal opportunity, not just for vaccination, but for their healthcare needs. Thank you so much for being with us.
Thank you so much for having us.
All righty, Rhonda Braxton, our guest here on Open. Want to let you know, if you want more information, of course, visit the website at children'saidnyc.org. And of course, on social media, you can follow them at Children's Aid NYC. We do have a lot more show coming up, so we encourage you, don't go anywhere. Open continues coming up right after this. And welcome back to the show. As head of the Pediatrics at AdvantageCare Physicians, our next guest is a vocal advocate for children as well as community health, focusing on underserved populations. Now, deeply attuned to the mistrust that's actually held in healthcare systems by communities of color, and as a Black woman physician and leader, she emphasizes empathy, education, and quelling fears and hesitation towards the industry among her patients. She's also recently been named as the Crane's 2022 Notable Black Leaders, and we want to welcome right now the Department Chair of Pediatrics at AdvantageCare Physicians, and we've got Dr. Beverly Sheppard. And Dr. Sheppard, glad to have you with us, and congratulations on this high honor.
Thank you for having me. Thank you.
Yes, and so as we talk about disparities in healthcare, we know that particularly in African-American communities, communities of color, there are already these health disparities. But when we talk about COVID-19, we could talk about the disparities in communities of color, but then drill it down a little bit further and talk about how it actually affects young people, especially in that pediatric age. So talk to us about what are we seeing right now as we're navigating through COVID-19 with the disparities and the push to really get young people into the healthcare system.
Yes, the disparities were quite apparent during the COVID, and currently apparent during this pandemic that we're having right now. As we all know, these disparities have existed prior to the pandemic, and what the pandemic did was just basically put a spotlight on it. Black and Latino populations were dying at a higher rate from COVID-19. We were suffering from more of the morbidity and the complications, significant disruption in our families. Um, we at Advantage Care Physicians wanted to address that, and myself, as the chair of the Department of Pediatrics, wanted to ensure that the 48 pediatricians that I supervise and oversee, that we continue to offer as much advice as we can, as much, excuse me, as much education as we could to our population, because we do serve a community of basically disadvantaged youth and families and children of color.
Yeah. So, what do you notice to be some of the primary challenges that we're facing, particularly as we talk about young children of color when it comes to healthcare?
Vaccines. I think that the inherent distrust that we see in the Black community with regards to healthcare and how we were treated in the past as a community, there is that distrust that makes our community hesitant sometimes to seek medical care and to seek it in a timely fashion, so that by the time we see some of our patients, it's really very late in terms of the disease process that has taken place. And some families are hesitant in terms of getting vaccines for their children. I mean, it's a well-known fact, and science has proven that vaccines prevent disease. They prevent polio, they prevent whooping cough, they prevent diphtheria, they prevent tetanus, they prevent measles. It is a well-known fact that vaccines are safe and they're effective. And it is so imperative that we as a community immunize our children against these diseases. And it's something where we're seeing that lag in our communities, and it's something where we try to educate our population as much as possible as to the safety and efficacy of vaccines. So as a pediatrician, I believe in preventive care. I believe in children getting vaccinated against these diseases that can be lethal, that can be fatal. And that is my goal, to educate as much as I can on the community level, on the office level, on the individual level, and in venues such as this, being able to speak to my community.
Yeah. Well, as a person with boots on the ground, obviously you do a lot of talking to young people as well as to parents. When it comes to the issue of vaccine hesitancy, are we seeing that it's still prevalent, given the fact that we go from one variant to another, and a lot of people sometimes have distrust in what we're hearing out of government, because it seems to be mixed messages. One day we're good, one day we're not. One day it's mask, one day it's relax the mask. You know, a lot of moving changes, and I would suppose that when you have this hesitancy, all it does is make people a little bit more hesitant.
Right, and you're absolutely right. And so what we have to remember, Daren, we're living in unprecedented times. None of us have lived through a pandemic. Okay, the last pandemic was in the early 1900s with the influenza, and so this is uncharted territory for all of us. So what we're doing is, you have to follow the data. You have to follow the trends, and you have to make decisions based on the data and the trends that you are seeing. So yes, we have seen variants with regards to this virus. You know, we had Delta, now we have Omicron. You know, what's coming next, we don't know, but we know that there will probably be other variants. And we have to be prepared to be able to protect ourselves from those variants and look at the behavior of these variants. How lethal are they? How virulent are these variants? Are the vaccines working to mitigate some of the fatalities and the complications that we have been seeing in the past? And the data has shown that vaccines do help. Vaccines do lessen the rate of hospitalization, lessen the rate of death, lessen the rate of severe disease with COVID-19. That information, that education, that knowledge must be imparted to our community, that we will feel confident in coming in to be vaccinated. And I think we have to continue, as I said, continue to educate and understand where our people are coming from when they manifest or they discuss the fact that they are hesitant. Some of my patients will say to me, "Oh, this vaccine was made too quickly. How come they have this vaccine out so quickly?" Well, And my response is, thank God we were able to get this vaccine out in a rapid manner. And the reason why we were able to do that is because of modern science. Science has progressed considerably from back 30 something years ago. I've been in practice for over 35 years, okay? The vaccines that I administered 35 years ago, they've been modified. They're even safer than what they were 35 years ago. But by the same token, they were all still very, very effective. You know, when we talk about vaccine hesitancy, I try to relate some of the personal experiences that I have. Okay, so we actually went into the schools and started vaccinating children in school against COVID-19. And a lot of parents are like, oh no, I don't want the vaccine done in school. Well, as you can see, I've been around for quite some time. When I was a child, the polio vaccine was administered in school. You know, in the late 50s, early 60s, in kindergarten, I was instructed by class. We all went down to the auditorium. We held out our hand. They handed us a sugar cube, which was our polio vaccine. It was given orally then. Now we give it as an injection because it's safer to give the injected model of the injected formulation of polio vaccine. But it is very effective. Do we see polio now? No. And why don't we see polio? Because of vaccinations. Do we see smallpox now? No. And why don't we see smallpox? Because of vaccinations. In fact, smallpox has been eradicated. So we no longer administer that vaccine. That is not one of the routine immunizations that we give to children. So do we just want to just arbitrarily just inject children with unnecessary vaccines? No. Or unnecessary medications? No, we do not. When the threat is gone, we stop administering that medication or that vaccination or immunization, if you will.
Yeah, I can't let you go without asking you this question, because when we talk about vaccine hesitancy, we know that it's real in communities of color, a lot of distrust. And when we talk about coming into the office, and I've got an African-American healthcare practitioner right in front of me. So there is a level of trust, I would assume, that you bridge the gap in many kinds of ways, because, you know, we understand that there is racism also in the healthcare system. So give us a little bit about what that's been like for you, being this woman who's an African-American woman who has the ability to actually talk to clients. And I know that there's a sense of trust that's built by seeing someone who looks like them, understands the plight of the community from behind the desk.
Right. And so I've been both patient and a provider. So I can speak from both sides of that table. And, you know, one of the things that I impart to my patients is, and make sure you ask the questions. There's no such thing as a dumb question or an ignorant question or a question that it's inappropriate. Ask the questions. If you're not clear, ask it and ask it again. Okay, try to develop that communication with your physician. I myself have been, you know, my family have experienced instances where we felt that perhaps, you know, it could have been handled differently within the healthcare profession, even with myself as a physician. So you want to ensure that you're asking the questions. Make sure you keep those lines of communication open with your doctor. And if you do not feel comfortable, then by all means, you know, request a switch of your primary care physician. You know, we do need to see more people of color taking up jobs and pursuing careers in the healthcare professions. I mean, we need more diversity within healthcare to address some of the cultural differences, not just among African Americans and the healthcare profession, but also Asian Americans and Latino Americans and Muslim Americans. We want to be able to address all of the diverse communities that we have that make up the United States, that make up New York City. And at AdvantageCare Physicians, that's one of the things that we strive to do. And I think that we do a very good job at it.
Yeah, I'm coming up on a hard stop, but I want to be able to ask the question before I go. You were recently named to Crain's 2022 Notable Black Leaders list. Just first of all, congratulations, and second of all,
thank you.
Your thoughts on being awarded.
Well, it's truly an honor. I mean, I've been in the practice, as I said, for over 35 years, and to be recognized for the work that I do is truly an honor. But even though it's an honor, it's what I do, and I, even without the recognition, it's something that I want to do. I want to be able to make a difference in the lives of our young children. I want to be able to set an example for our children of color, to empower them to know that, you know, certain goals are attainable in life, and that they should continue to strive and to just present, you know, a healthy lifestyle. so that, young people will pursue that avenue as opposed to others.
Well, Dr. Sheppard, it's definitely been an honor having you here. And thank you again. Congratulations on being named to Crane's 2022 National Black Leaders List, and also for the work that you've been doing in impacting the lives of so many people. It's been our pleasure. Thanks for being with us.
And thank you for having me. And you keep up the good work that you're doing, also getting the word out to our communities.
Gonna try. All righty. Well,
Okay.
listen. Well, if you want more information, please don't hesitate to visit the website, acpny.com. And then also follow them on Facebook and Instagram at AdvantageCare Physicians. We do have more shows, so we encourage you, don't go anywhere. Open continues coming up right after this. And welcome back to the show. Whether it's a problem with alcohol, opioids, or any other substance, substance abuse actually kills thousands of Americans every year and impacts millions of lives. Care for the Homeless is an organization that's bringing essential medical, mental, and behavioral health care to people who are experiencing homelessness in New York City. Here now and sharing more details, we've got the substance abuse counselor at Care for the Homeless, Luis Fernandez. And Luis, thank you for being with us. And tell us a little bit about where we are today, because as we're navigating this COVID pandemic, I know for a fact that the use or substance abuse continues to be on the rise.
Yes, it is. And one of the main problems that we're having is the increase in uses of fentanyl. Is a very very powerful opiate that is being produced now in the streets. And the problem with the fentanyl is that it's killing a lot of people out there in the streets. There's a lot of overdoses that we encounter almost every day. But we do have some treatment for it. Our Suboxone program has been able to curtail some of the overdoses. And we also, do a lot of street outreach in the streets. So we basically go out to the streets about 3 days a week in the South Bronx, especially around 3rd Avenue, 149th Street. And we just take them out of the streets and bring them into the shelter system. Right now, we are operating out of 800 Barretto, and we coordinate our whole services also with Bronx Works. Whereas, guys in the street, the first thing that they want is a room, right? They usually don't talk about substance use. When you want to approach them about, how can I help you with your problem? First thing they want, can you help me get a room? So what we are able to do now, and we've been very successful, is, we are able to provide them a room at that moment, but with the condition they come in, and we are able to provide them with, with the medical, mental health, and also the substance abuse programs that we have, which is right now is the MAP program, Suboxone program. And, we've been very successful with it, but at the same time, when COVID came around, it was a shock to the nerve, to reality in a way. We lost a lot of people, and not only because of COVID, a lot of people were using. The usage got more intense when COVID came around, but it does fluctuate a little bit. But right now we're getting much better with it.
I know that when you talk about the work that you do, dealing with the homeless population, those who are involved in substance abuse, very intense, very critical work. So when you have people in the program, how is it in terms of retention? Are you able to retain a lot of those people who enter into the program? Do they stay, or are we seeing, in, out? How's it working?
Okay, yeah. So our program, like the Suboxone program, has really been successful, but right now it fluctuates, right? Sometimes we get a person for a week. Sometimes we get them for 2 weeks. We have had some very successful clienteles that from the moment we started in 2016 up to now, they are still with us. And, if I could tell you their stories, they came in without nothing. And right now they are actually, fully employed. They got their permanent housing and they living a very healthy life. So we do have some success, but also there have been some struggles with it because there's a lot of guys that are, sometimes they need more structure than the program can provide, and that's where the retention comes in, is that it fluctuates, sometimes.
Yeah. So when we talk about services that your organization provides, why don't you walk us through a little bit more about what's available to those who come into under your doors?
Sure. So we have Care for the Homeless has been in inception for 35 plus years. We have brought essential medical and mental health, behavioral health care to people experiencing homelessness. We currently operate 27 health clinics throughout the 5 boroughs, throughout the 5 boroughs. In 2008, we opened up a female shelter, for the mentally ill and medically frail. And as of 2008, we have been able to provide permanent housing for 1,000 of the females. We are currently, opening up another safe haven site in Morris, right across the street from Lincoln Hospital. And we also have another site, just like the one in the Bronx for females, 52nd Street in Manhattan, which also provides the same services. Care for the Homeless, basically, if you come in, if you got Medicaid, if you don't have Medicaid, we will provide you services with medical, mental health, whatever services you need, medications you need. We are walk-in services 5 days a week. If you need to see us, if you have an emergency, you could call our number 212-366-4459, and somebody will be able to help you out in less than 24 hours.
So for people who want to know, you have people who come under your doors, they need help, you're able to help them. But sometimes folks don't make it under the door. And
Right.
families have to deal with this at home. So what advice do you have for a family member that may be having a loved one that's actually dealing with this substance abuse issue? How could they go about being of best support to the person that's really using and abusing?
Well, I encourage everyone and anyone in the city that if they need any help, to call our number. They also, the city has some hotlines that people could call, but it's basically, because when the family is involved with someone that's having a problem, the family's having a problem also, right? So they're part of the addiction. So, the best advice I could tell them is that to either call us or call the city. The city, they have the website is nyc.org. And they could call the city or call our agency, Care for the Homeless. We will be able to provide them services. Like I said, there's no need for, if they don't have insurance, that's not a problem. And basically, and we treat people with kindness, respect, and they will get the 100% support from us.
Yeah. Well, Louis, we're going to leave it there, but thank you so much for sharing. Thank you for helping those who are really the most vulnerable in a time like this. And sometimes we don't pay attention to how bad it is, given the fact that we've got so many other things we're navigating through COVID, but substance abuse, a really big problem for so many people. Glad to have people like yourself there helping out. Louis, we thank you so much for being with us.
Thank you. Appreciate it.
All righty, Luis Fernandez, our guest here on Open. He is working with the area of substance abuse counselor at Care for the Homeless. Now, if you want more information about Care for the Homeless, well, go to their website, careforthehomeless.org, and you can find out just how you or a loved one can receive some assistance. Taking a quick break, we've got more Open. Don't go anywhere. We're coming up right after this.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
And welcome back to the show. The Gathering for Justice is a not-for-profit organization that's aiming to end incarceration and eliminate the racial inequities permeating the justice system. Now, in honor of the 95th anniversary, I should say the birthday of the organization's founder, Harry Belafonte, a single was released, I Believe, and the words featured were the words of Mr. Belafonte during the organization's first founding in 2005. Joining us now and sharing us a little bit more about the exciting single and her voice on it, we're pleased to have Keris Love. And Keris, good to have you.
It's good to be back.
Good to be back. We haven't seen you in a minute, but glad to have you back with us and sharing. And so this single obviously is a celebration of Mr. Belafonte's 95th birthday and some of the work that he actually did from the beginning. So walk us through why you decided to do the single.
Well, Carmen Perez Jordan, who is the ED, CEO of the Gathering for Justice, and Mr. B's mentee and my mentor, she gathered myself, my son, Jackie Cruz, and FIFA together and asked us to, we need a song for our current movement. It was really important for the Gathering to have, to integrate the arts, because Mr. B always talks about artists, artists are the gatekeepers. Artists have to use their platform to speak on what's happening in the movement. And so the art piece of why we do what we do, why we march and rally and organize to change policy is really important. And so Carmen was like, listen, we need our movement, and the civil rights, they have freedom songs and songs that they chanted as they marched. And we needed the same thing right now, currently, so that it could uplift us while we're out in the streets, while we're organizing, while we're lobbying, all of the things. She got us together. When Carmen asks for something, she usually gets it.
Yeah. So you guys get together, you make the song, and tell us about Mr. B's reaction when he first heard the single.
I mean, that was definitely, everyone's heart was like waiting to see what Mr. B would say, because of course we needed his blessing. And his reaction is, it just lives rent-free in my mind. Just watching him, looking at the tablet and listening to it and bopping to the beat and then swaying. And then it was just the most beautiful thing ever. And he looks up and he goes, "This is beautiful." And it just made it all come together. And it was very intentional to have his voice in the beginning and Carmen's voice at the end, because this is an intergenerational movement. And that is something that they both talk about. I'm standing on the shoulders of my Nana, who was a freedom fighter and a former Black Panther. We are all standing on the shoulders of our elders. We're not doing this, in these silos, and our elders leave us breadcrumbs. That's what Mr. B says. So it was really intentional to start it off with his voice and end it with Carmen's.
So as you take the work that you're doing right now and moving it forward, talk about the initiatives that you're really speaking to and really are organizing it on the front line right now for, because Mr. Belafonte definitely gave you a firm foundation in which to launch off of, but now the work continues and you're the front line, your boots on the ground. Where are you, what's the focus of your energy right now?
I mean, the focus, and again, the pandemic has shed light on the inequities in our communities. The focus is always going to be liberation for Black and Brown folks. The focus is always going to be to ending mass incarceration. Mass incarceration is a manufactured ecosystem. You know, the 13th Amendment says that slavery is legal under mass incarceration. It's legal under, that's the way we can keep slavery going. We need to start using those terms in those ways. And so the fight is still over policing, but the fight is also economic. And so we can't talk about safety and crime without talking about poverty. And the pandemic just increased that. We have to talk about stagnant wages. We have to talk about why women still make less than white men and why Black people, and the wealth gap. The wealth gap didn't happen overnight. The wealth gap didn't happen because of personal responsibilities. These are structural things that created this wealth gap where the white family has X amount of dollars and the Black family has, I think it's like federally like $17,000, and the white family has like something towards like $100 and something thousand. Like that wealth gap is really what we're talking about. And so we're still fighting for that. We're still fighting for voting rights, which is pretty ridiculous because we just celebrated the anniversary of when our elders marched across the bridge in Selma, and a lot of our folks were there. And it dawned on some of us that we're marching with the same demands because the system continues to move the goalposts. So we win a bunch of things in the civil rights, and then policy and legislation comes up that are oppressive and then knocks us back. And so we're still carrying these same pieces of legislation and policy. And really what it is people just want to be able to take care of their families. We don't want to be over policed. We don't want to have to live paycheck to payday. And so that's where we are. And that's what we're going to continue to fight for.
And as we talked from the beginning, you know, your work is really the off of the shoulders of really Mr. Belafonte and the work that he's done as a social activist down through the years. What advice has he imparted into you into keeping the fight alive and how to really achieve these results via activism?
Well, one thing he says is that every generation is responsible for their own revolution. And I love that because they left us some blueprints, but we are responsible for taking the baton as far as we can, right? And so even after the release of this, after Mr. Belafonte heard the song, one of the things that he turned to me and said, you have to continue to use your art as a way to tell the story of what's happening on the ground with our people. And that's what I'm going to continue to do. I'm going to continue. The gathering is not done putting out music. We're not done putting out, we're going to be getting into film and all the things. We're not done because we have to tell our story. And so part of my job is to use my artivism, as Carmen would say, as to tell our story and to tell the truth. We know that fear mongering is big, especially when you're talking about community safety. They're out there telling us that it's because of bail and it's because of all these things. And we're not looking at the fact that poverty is at the root of a lot of these issues and how poverty is manufactured here in this country. So I'll use my art to keep telling those stories.
We're going to use your art and we're going to use this song to know more about what is going on in the world of social justice and really making a difference. Keris, love, thank you so much for being with us and sharing here on Open. Again, before we go real quick, how can people find out about the single? Where can they go?
It's streaming everywhere. It's on Apple, iTunes, Spotify, Tidal, YouTube. I mean, you can add it. You can, on TikTok, you can add it to the background of your videos. I mean, we're everywhere. We're everywhere. You can just If you're searching by artists, you can search by Gathering for Justice and it'll come up, I believe. But even if you search the individual artists that are on there, like myself, Keris, if you type in Keris, if you type in my song, type in Jackie Cruz, our song comes up.
All right. Keris, got to leave it there, but thank you so much for being with us, and congratulations on the single and much success. Thanks so much, Keris. Love.
Thank you.
All righty. Well, we want to let our viewers know that if you want to find out more information, we encourage you to go visit their website, gatheringforjustice.org. And of course, visit them on social media. How can you do that? Well, you follow them on social media at Gather for Justice. We've got more Open coming up. Don't go anywhere. We return right after this. Welcome back to the show. Well, established in the year 2014, the Fitter Woman is a holistic wellness program that's providing its clients with a personalized wellness experience. Now, our next guest has worked with active C-suite and entrepreneur women to empower as well as encourage them to understand and utilize the self-care techniques she teaches for over 20 years. We're pleased to have holistic lifestyle coach and founder of the Fitter Woman Incorporated, Orlandina Balan, and she's here with us. And thank you, Orlandina, for being with us. And when we talk about women and self-care, it's very prevalent in these days, particularly amidst this pandemic, for self-care. But I know that you paid particular attention to the busy woman and the one that's out there, the entrepreneur woman. So talk to us about your work.
So what I do is I work with busy women because they're the ones out there in the front lines. They're at the front lines at work. They're at the front lines in their businesses, in their families, in their communities. And their biggest challenge is time. They're making time for everyone else. They don't have enough time for themselves. So that's what I do. I help them to find that time in their busy schedule and encourage them to make time for themselves, because without them, nothing can come of them. So they have to take care of themselves first.
Yeah. And so as they guide them through this area of self-care, what are some of the components that a woman that comes under your tutelage receives?
So I look at her as the whole woman. So we look at her fitness, trying to make sure we create time for movement in her busy schedule. We look at how she eats, creating nice, delicious meal plans that she can eat and she can share with her family, and making time for her me time. So it's not always just the nail care and the hair care, which we all love, but just that time for self-reflection and just that quiet time. So we look at her as a whole woman.
Yeah. So what do you say to women who really have this as an issue? Because there's some women who say, listen, I really want to be able to work out and do these things that require self-care, but I have this busy and demanding schedule. How do I overcome that?
You have to say to yourself, I have to put me first. It's a decision first. I have to put me first, because once you've done that, then you start to plug yourself into your calendar, just like you plug your doctor's appointments, children's sports schedule. You have to plug in your me time, and that becomes your untouchable time. And then we take it from there.
You got a very special event coming up too on March 26th, Love in Motion. What's that about?
Let me tell you, I'm so excited about this event. It is a time for women to all come together, like-minded, like tribes, and we're going to move that body. We're going to be dancing salsa. We're going to be doing a little hip and heels. And I've brought all these self-care professionals all under one roof so I can connect you all to different components of self-care, skincare, health, in terms of physical therapy, pelvic floor health. We even have a matchmaker to take care of the wealthy relationship wellness component. It's just going to be a fun time.
So for women right now, what do you find to be the biggest challenge when it comes to self-care?
Time. I tell my ladies, we have to reclaim our time in order for you to reclaim that waistline, right? So
I like that.
you got to reclaim your time to reclaim your waistline, because the time that you spend ripping and running in this body, guess what? It's this body that deserves that time so you can continue to rip and run. This is the body that you were given to fulfill your purpose. So you have to take care of it. You must take care of it. You come first. That time is the biggest issue with those busy women. They know they need to take care of themselves, but how do they do it? And that's where I come in.
Well, we have people who are working 8, 10, 12, 14, sometimes 16 hours a day. Taking that time out is extremely critical from your perspective. How much time does a person need to be able to dedicate to be able to get these kind of results that we're looking for?
Listen, even if you move your body for 15 minutes or 30 minutes a day in your office, there's so many amazing movements that you could do just in your office or in your business. Parking far further than you, let's say you want food shopping, park furthest part of the parking lot. Be safe, of course. Just choosing not to go into the snack machine and bringing your little snacks, going for coffee walks instead of a coffee run. Creative ways to do it. And I would even encourage you to find a buddy to do it with, so that you can encourage each other. Because it's nice when you have people to just kind of hold you accountable. And that's where we come in, because we connect you with like-minded women. So to help you stay on track. But just 15 minutes, you deserve that. Just 15 minutes a day.
Yeah. So Saturday, March 26th is the big day for you. And give people the opportunity to get connected. What do they do if they want to be a part of this event?
thefitterwoman.com. Go and visit thefitterwoman.com. And I and my team, we're going to help you to walk bold, fit, and fabulous out in this world. It's going to be a great time. Bring your girlfriends, bring your tribe. It's going to be a blast.
Yeah. We've got people out there talking about the COVID-15, the COVID-20, and that's simply for somebody that doesn't know pounds that you actually put on since COVID. Are you finding that more and more people are coming to you with the COVID-15 and the COVID-20?
Yeah, I call it the panda pounds, the pandemic pounds. But they're coming with the pandemic mindset also, because you're still in that trapped mentality. So yeah, a lot of people put on weight for stress, lack of movement. And guess what? Just like it came on, we can get it off. But we got to adjust that pandemic mindset and and then we'll get rid of those pandemic pounds. Yes.
Yeah. All right. Well, Orlandina, it's certainly been great talking to you. And best wishes for your event on the 26th, the Fitter Woman. And we want you to know Fitter Woman University is what she's created at Women Love in Motion, Women's Self-Care, Saving Time, and the Waistline, taking place on Saturday, March the 26th. And if you want more information, don't hesitate to visit thefitterwoman.com. Orlandina, thanks so much for being with us.
Thank you so much for having me. I so much appreciated.
All righty. Well, we want to let our viewers know, yes, we are at the end of our show today, but listen, we want to thank our guests for joining us. Most of all, I want to thank you, the viewer, for tuning in. Now, if you missed any part of today's show, don't forget, you can catch the Recablecast on BronxNet's Channel 67. Also, if you have Verizon Files, that'd be Channel 2133, or anytime on the web at bronxnet.org. We also want to thank our viewers who've been watching on Manhattan Neighborhood Network, as Open is broadcast live simultaneously on the MNN channel. Now, if you want a brand new episode of Open, what do? Well, come on back on Friday morning. My girl, Rena Valentine, she'll bring you the best in arts and entertainment, and I hope that you'll be able to enjoy that show as well. I'm Daren Jaime here on this Wednesday Open, wanting to let you know, listen, keep this channel wide open. Take care, and God bless.